home care, aerosolized, and humidity therapy.
What's the first thing you want to do with home care?
As you already know, like Julio said, gloves. But you do need to have your equipment set up. So as you have here, we do have our oxygen concentrator. It usually looks like this, or it might come in a different model or anything. The doctors will usually tell you your orders. Here we'll have the air compressor. Turn on. We'll have our large volume nebulizer. And then if they're a trach patient, we're gonna be using the heater.
Also known as?
The donut. Okay. You're gonna set it on here. And then you're gonna connect this on to nursing homes. Have a red outlet because it's the backup generator. Don't forget that.
Do you always add the heated donut?
Only if it's a trach patient.
Why?
Because we're bypassing their airways.
Good to know. So for the hospital setting that I did, we did a mask because obviously they were able to breathe with their upper airway. How would we give a treatment with the patient on a trach?
Okay, so for home care, we have a neb here. You turn it on. It's a compressor, basically. It sounds like a compressor. It connects through here. It's going to connect to the patient. Okay, for home care, we're always going to want this close to the patient. So we're doing trach, and I'm going to have to disconnect some few things here. Well, this is perfect, actually. We're going to connect this right here. Well, that's kind of close to the patient already. This will go right here perfectly. This, we're going to connect to the machine. So if you follow me, right here. Okay, perfect. You know, there it is, aerosolizing, right? But usually this is up straighter so that the liquid is not, tipping over. Right now there's no liquid, so we're good. Same thing as this one, as the hospital, as Julio had stated. This is gonna be like this. We're gonna connect this right here because this is gonna connect to the oxygen, which is we're gonna need another port, tubing wiring, you could say. This will be connected right here at the bottom. Make sure it's secure because you don't want it to pop off. And so 28%, so that's gonna be 2, which this is like 3. So that's gonna be at 2. We have to turn on the air compressor, turn on the neb. I'm gonna do this again from the beginning. Trach patient right here. We're going down here. It's connected by the neb cup. We're going right here to the nebulizer. The trach patient is heated right here. Right here, their bag is right here. And as well as here, they're getting their oxygen. They're getting 28%.
And there you have it. This is how we set up our trach patients at our nursing homes, especially post-acute, or the hospital settings, how we set up the patients on nebulizer treatments as well as oxygen.